Aesthetics 360. I'm Sherry Jamko, and with us today is Dr. Gauri Agarwal, a highly esteemed IVF specialist based in India. Dr. Gauri Agarwal is the founding director of Genestrings Diagnostic Center in India. She's also the director of Seeds of Innocence, a leading chain of IVF centers with locations in India and expanding to the GCC and Africa as well. With her compassion, she's helped many couples achieve their dream of parenthood. It's a pleasure to have you with us today, Dr. Agarwal. Please tell us, let's begin with what exactly is in vitro fertilization?
So a lot of couples nowadays are having problems with fertility. So WHO has recently said 15% of my couples are undergoing fertility. And most of the couples just don't need IVF. Some of them need a medical consultation, some of them need an IUI, and some of them need an IVF. So in vitro fertilization is where you take hormonal injections for 10 days. We take those eggs out through an ultrasonic needle, and then we inseminate them with your husband's sperm. We make babies, that is embryos, and we transfer these embryos inside the woman's womb. So this is actually required when both the fallopian tubes are blocked, when you're not able to conceive after 3 or 4 failed IUIs, when your ovarian reserve is very low, that is your AMH is low, or your sperm count in the husband is less than 2 million. So in certain conditions, it becomes very important for the couple to undergo an in vitro fertilization.
Now, roughly 1 in 6 people are affected by infertility, according to the latest figures by the World Health Organization. Is IVF a solution for most or all of these cases?
Exactly as I said before, IVF is not required in every couple. Some people just don't know how to have a normal intercourse. They don't know what are their actually good periods and bad periods to have a normal intercourse. So explaining them, counseling them, and telling them exactly what happens can actually help them to conceive normally on their own. Some people just require mild medications, and with medical treatment, it is possible for them to conceive. Some people require an IUI where medical treatment doesn't work, or maybe the sperm count is low, but the tubes have to be open, the egg count has to be good, and the sperm count has to be okay, like between 10 to 20 million. Those people can opt for an IUI. And as I indicated before, the indications for IVF, and some people need an IVF. So there are various steps, and we have to categorize our patients accordingly, and we have to give them a protocol accordingly.
So let's say a couple has to go through all those steps from counseling to testing and then going ahead with the IVF. What sort of costs are associated with such a thing?
Definitely, everybody says it's very expensive, but I would say that it's not that expensive because, IVF is just not a surgery. We have to use a lot of disposables, consumables, media, injections, and these all costs a lot to the clinic. Plus, maintaining the quality of the lab, maintaining a good doctor, maintaining an embryologist, and your clinical team, plus legalities is a very important aspect for an IVF lab. So somewhere around 2,500 USD is what an IVF costs for any person.
So how long does an IVF cycle take?
So normally an injection is given from 10 to 12 days from the second day of the periods. And if my endometrial line is not very good, or maybe my eggs are too many, so I don't prefer to transfer the babies in the same cycle. And then it happens to be a frozen embryo transfer, and we transfer the babies in the next cycle. So approximately 1.5 to 2 months is what is required for an IVF cycle.
What are the health risks associated with IVF for both the mother and fetus?
IVF definitely is not that risky. Some people may have, after pickup, a mild hemorrhage, or maybe it's a blind procedure, then very rare chances to have an ovarian torsion, that is the ovary rotates. There can be chances of an ectopic pregnancy, that your baby doesn't stick in the uterus but goes and stick in the ovaries or the tubes or the cervix. Or there can be kind of a small bleeding. Or there can be, some people feel that twin pregnancy or triplets is a complication, but for me, it's a blessing in India.
So does IVF involve perhaps the use of a sperm or egg donor in any certain cases?
So whenever my AMH is very low, most of the patients we prefer to actually have by their own self eggs. But if my patient is not responding to injections and I don't get good quality eggs, then sometimes we have to ask the patients for donor eggs. And similarly, if on biopsy or TISA, that is testicular epididymal extraction, I don't get good quality sperms or I don't get sperms, then I have to counsel them for donor sperms. So that is an option available for my couples to undergo donor sperms or donor eggs.
Do doctors perform genetic testing on the actual embryos created through in vitro?
I was the first in the country to be starting genetic lab. So any couple above the age of 35 or couples with one failed IVF or couples with like 2 or 3 recurrent abortions or couples with low sperm count, I prefer to do genetic testing on the embryos, that is PGT-A, screening of the embryos for any genetic problem in the baby.
So are there other fertility treatments as effective as IVF today?
Especially in the cases of male infertility, lots of men have zero sperm count, that is azoospermia. And they feel, since it's azoospermia, that means their sperm count is dead and they need a donor sperm. But actually what happens is there is a blockage of the tube which brings the sperm out. So in that case, we can do a biopsy of the testes, take out the sperms and do ICSI in this case, where we inseminate one egg with one sperm under the microscope. And this is how, even with a couple with azoospermia, that is nil sperm count, can they have their own genetically healthy baby. Second thing is a surrogacy, which definitely has a lot of legal boundaries in different countries, but that is also a blessing for most of the couples.
And so on to the next question about Seeds of Innocence. North India's first IVF chain is now growing overseas. Can you give us more insight into which countries you're going into and how it's been doing?
So Seeds of Innocence is something, it was the first center in India to have in-house genetic lab. So my purpose was, not just to do IVF. My purpose was to bring about a healthy baby to my couples. I think which is more important. So one day what happened is a couple comes to me and a very poor couple takes a loan and tells me, ma'am, do me my IVF. I said, look, IVF is not 100% successful, but I'll try my best to give you a baby. This couple conceives. But at 20 weeks, I come to know that this couple has a baby with Down syndrome. I mean, I was completely shattered. I didn't know. I thought I'm not doing the right work. And that day I decided, let's have a genetic clinic where we test the embryos before getting them implanted. And so it's a tailored program for us. I mean, for us, it's just not IVF. We do a lot of permutations, combinations. We make a program for the patient. And across our centers, it's like that. So our team has been trained to take it like that. And that's why we started a center in Muscat. We are going to be there in Zambia, Nepal, and Dubai soon, and soon in Mexico. So that's what we are waiting for.
So blessed to have someone like you in this field. And now to my final question, what are the ethical concerns surrounding IVF, particularly with regards to the creation and disposal of unused embryos?
There are a lot of issues because some of the couples, they conceive and they leave their embryos behind. So it depends from country to country. Every country has a separate guideline. If the couple allows you, you can go ahead with the research for those embryos. I mean, some countries allow for donation of those embryos. Some country allows that you have to discard the embryos. So every country has their fixed protocols, exactly how to follow with these ART rules. So that is a very subjective question depending upon country to country. But still, I feel giving blessings to a couple is what all we need to know.